How's it going? It's Dr. Greg Marin here at One Spine Chiropractic. Today we're discussing knee issues and how we as chiropractors treat knee issues. A lot of people don't think a chiropractor would be treating knees, that we would just work on the neck and the spine, but you'd be surprised how many knees, feet, shoulders we work on here because we have some advanced training to help us get relief with the knees, but more importantly, diagnose and treat that properly. So with the knees, what we want to do is first of all, get you in here for a consultation, figure out what's going on, how long things have been going on. The time and how long it's been going on is a telltale sign of, there's any degeneration, arthritis involved, or any other wear and tear. So first of all, we'll talk, see what's going on. Secondly, we're probably gonna do some orthopedic testing to figure out if it's coming from a meniscus, maybe a ligament, maybe a muscle strain. So we're gonna talk as well and see what kind of mechanism of injury recently or even in the past that happened and injure yourself. Okay, once we do that, depending if there are any red flags or positive signs, more likely we'll take an x-ray of the knee to figure out if there's any wear and tear, if there's any deviation, the way things are aligned, because more importantly as chiropractors, we actually align that knee properly to get things where we need to. So what we want to do is make sure we figure out how that knee is functioning, make sure the motion properly is in there, because without motion, unfortunately with time comes wear and tear and degeneration. So the big thing as chiropractors, we actually adjust the knee to sit that properly, which we'll show you a video later on how we do a specific knee adjustment to get things moving better, feeling better, and get you healing up properly. So besides the knee stuff, we also want to take a look at the lower back and the pelvic area, because not only do these areas affect your gait, your weight distribution, your walking, what happens a lot of times is these nerves that come to that lower back and pelvis actually innervate the nerves that go into the knees, the muscles, the tendons, the ligaments. So a lot of times you might have some referral pain from an injury back here, sending that to the knee. We'll test it out, make sure it's not a knee injury. If it's not, we'll go ahead and evaluate that lower back properly. Make sure we get pressure off the nerves, the discs, the bones. That way everything can communicate with the brain and the body, and that nervous system will work the way it needs to. Because the nervous system working properly, you'll have less pain, inflammation, and more importantly, your body will communicate and heal you up the way we need it to. So like we talked about, we'll take a look at the knee, we'll take a look at the pelvis and hips, see what's going on with the weight distribution, but as well, if it's more of a knee issue, we got several options that we do besides chiropractic adjustments. What we do here is for soft tissue injuries, we have some laser therapies, cold laser, class 4 hot laser, that'll get rid of pain, inflammation, and speed up that healing process so you get you out there doing the things you love doing recreationally and with your family. Another thing we've had added to our office is shockwave therapy. This shockwave therapy is pretty amazing because it's a chronic injury that's been there for some time, especially with tendonitis, adhesions, things like that. What we do is use that shockwave therapy around the knee and the tendons and ligaments, and it breaks up all that chronic scar tissue and adhesions that have been building up. So what we want to do is make sure we break that up so your cross fibers will sit properly, and more importantly, you'll have better motion in the joints, less pain, and more importantly, able to do the things you love to do. So there are a few options we have here at our office. So if you have any issues with your knee, friends or families have issues with knee, give our office a call. We're here, ready to help, wanting to get you back to doing the things you love doing. Thank you.